The Health Department over the weekend has confirmed the appointment of former PNP Chief Camilo Cascolan to the agency. Here's what we know. Cascolan was named PNP Chief by then-President Rodrigo Duterte in September 2020, but left only 2 months later after reaching the mandatory age of retirement. Cascolan served as the co-author of the Oplan Double Barrel, which focused on high-value targets under the government's war on drugs. Just days ahead of his retirement in November 2020, Cascolan said he was open to a new government post. He was then appointed as Undersecretary of the Office of the President in February 2021. In terms of health-related work, Cascolan conceptualized and headed the PNP's administrative support for COVID-19 task force. The Alliance of Health Workers has since denounced Cascolan's appointment, saying that he is not qualified for the job.
No, ang dami po mga qualified na mga doctors na nasa loob ng Department of Health. Kahit sa labas, ano na ang gagawin niya during the MANCOM EXECOM meeting kung maisasuggest niya tungkol sa usapin sa mga sakit o ano. So talagang hindi natin pinapayagan na ang isang retired PNP chief ay nandoon siya sa sa loob ng Department of Health.
Now here to share her thoughts on former PNP Chief Camilo Cascolan's appointment as DOH Undersecretary, we have with us live via Zoom former Health Secretary Paulyn Ubial. Good evening and welcome to the big story. Former Sec Ubial, I mean, you've taken the helm of the Health Department in the past and you heard what health workers groups are saying here. That's actually an insult to health experts, this appointment of Cascolan as Health Undersecretary. What do you make of his appointment, and is it totally unheard of to have a non-medical professional appointed to the DOH?
Yes, Jester, and this type of appointment is not the first time. The President in previous administration have appointed former colonel of the AFP, Reynaldo Samaco, during Romualdez's time, and he was in charge of logistics and procurement. I think that's the only time, but there are non-health also that were appointed, like Attorney Alex Padilla, and he was in charge of good governance, as well as another attorney right now, Charade, I forgot, Grande, yeah. She's in charge of regulations and the legal office. So there are members of the EXECOM of the DOH that are non-health. And I saw the appointment of Yusek Cascolan, and he is replacing Yusek Roger Tong-an, who is a non-doctor, he's a nurse, and he was in charge of the administrative and human resource portfolio in the DOH.
Let's zoom in a little bit to Cascolan, and we have several people defending the PNP chief. Former Health Secretary Janet Garina said that we need non-medical managers inside the organization. Given the current state of healthcare in the Philippines with COVID situation, XBB, XBC, low booster rates, how do you think can the former PNP chief help, and what do you think should he focus on?
Well, as I mentioned, there are non-health portfolio in the DOH, particularly procurement, management, and human resource, as well as logistics. So he can actually help, like Yusek Alexander Padilla used to also take charge of the performance and good governance in the DOH. So that can be a portfolio for Cascolan.
Now, at the same time, former Secretary Ubial, what do you think, like what you mentioned, there are non-medical portfolios here in the DOH that Cascolan might actually be focusing on. But what do you think is the first and foremost, that should be the priority of Cascolan here? Should he be, well, he is already appointed as Health Undersecretary. I mean, some saying that is it really there to actually clean up the DOH for management purposes? What do you think should be his priority here?
Well, that's one of the things that actually a non-health portfolio can do. It's the performance, the monitoring, and of course, management aspect of running the health department that he can focus on. If he's former PNP chief, then I think also human resources, handling people and personnel, will be good portfolio for him to also address.
Okay, President Bongbong Marcos has said that he will not appoint a DOH secretary until the situation normalizes. He also says until the DOH's method of handling the pandemic is fixed, he will not name a secretary. Do you agree with that? And what do you think does he mean by that when he says there are things to fix inside the DOH?
Well, I'm not actually sure what the president means by fixing the DOH and having the pandemic end before he appoints a health secretary, because I believe a health secretary or a leader in the DOH is very much needed, even when the pandemic is over or the pandemic is ongoing. We need a leader, because somebody who is more or less permanent and can have the political will and the policies, directions set for the health department. If you're an OIC, you cannot move. You cannot make hard decisions. So I don't know why the president is taking such a long time, but it's not good to have an OIC in such a critical department of government.
Some are also questioning the appointment, saying that the former PNP chief headed the Oplan double barrel. He was one of the proponents of the war on drugs of the former administration. What message do you think does this send, not having a DOH secretary right now? And his first appointment as USEC is someone like Cascolan.
Yes, so well, it sends the wrong signal, particularly to the health sector, that the insider or people in the health sector are actually not able to handle the health portfolio or the health department. So it's not a good signal in terms of the morale and the confidence of the people in the health sector towards their own colleagues. And there are so many experts already within the DOH and even in the private sector that could have taken such a portfolio.
Okay, given all that, Secretary Ubial, what do you make of the DOH's performance so far, at least especially in handling this transition in the pandemic, in this stage that we are in right now?
Yes, right now, I believe that the DOH needs a head, a leader, so that the next 6 years will be firmly set in place. At that time, when I became health secretary as early as September, I already crafted the Philippine health agenda so that the next 6 years of the Duterte administration has direction, and we have the targets and the goals set. So I think it's very critical to really appoint a health secretary at this time.
Okay, very crucial to at least appoint a head for the health department. And again, the appointment of Cascolan, at least according to former Secretary Ubial, sending a wrong message. Again, thank you very much for your time this evening, former Health Secretary Paulyn Ubial.